Hey everyone, welcome back to my channel, all about you, your go-to spot for health and wellness tips. Today, we're diving into a topic that's been gaining a lot of attention lately, leaky gut. Ever wondered what it is and how it might be affecting your health? Well, you're in the right place. Leaky gut or increased intestinal permeability happens when the lining of your small intestine gets damaged. This damage allows undigested food particles, toxins, and bad bacteria to leak through the intestines and enter your bloodstream. This leakage can trigger inflammation and changes in the gut flora microbiome that might lead to problems within the digestive tract and beyond. But don't worry, it's not all doom and gloom. There are ways to heal and support your gut health. In today's video, we'll explore some practical steps you can take to repair your gut lining and improve your overall well-being. Before moving on, don't forget to like, subscribe, and hit the bell icon for more health and wellness content. Let's get started. The gut lining is normally tight, with cells that are closely linked by structures called tight junctions. These junctions regulate what passes from the intestines into the bloodstream. When these junctions become loose or broken, the intestinal barrier becomes permeable or leaky. Common symptoms associated with leaky gut include chronic diarrhea, constipation or bloating, nutritional deficiencies, fatigue, headaches, confusion, skin problems such as acne or eczema, joint pain, widespread inflammation. Several factors can contribute to the development of leaky gut, such as chronic stress, poor diet, especially one high in sugar, refined carbohydrates, and processed foods, excessive alcohol consumption, chronic use of non-steroidal anti-inflammatory drugs, infections, dysbiosis, imbalance in gut microbiota. Leaky gut is often discussed in relation to a range of chronic and autoimmune diseases, including celiac disease, Crohn's disease, irritable bowel syndrome (IBS), type 1 diabetes, and multiple sclerosis. However, it's important to note that while the concept of leaky gut is popular in alternative medicine, it is still a topic of ongoing research and debate within the conventional medical community. How to heal leaky gut? Healing leaky gut involves several strategies aimed at reducing inflammation, restoring the gut lining, and promoting a healthy balance of gut bacteria. Here are some commonly recommended approaches. Dietary changes. Eliminate trigger foods. Avoid foods that can irritate the gut lining, such as gluten, dairy, sugar, processed foods, and alcohol. Identify and eliminate food intolerance or sensitivities. Anti-inflammatory diet. Incorporate anti-inflammatory foods like leafy greens, berries, fatty fish rich in omega-3 fatty acids, and olive oil. Focus on whole, unprocessed foods. Increase fiber intake. Consume high-fiber foods such as fruits, vegetables, legumes, and whole grains to support healthy digestion and feed beneficial gut bacteria. Bone broth and fermented foods. Bone broth contains collagen and amino acids that may help heal the gut lining. Fermented foods like yogurt, kefir, sauerkraut, and kimchi provide probiotics that support gut health. Supplements. Probiotics. Probiotics can help restore a healthy balance of gut bacteria. Look for high-quality supplements with multiple strains of bacteria. Prebiotics. Prebiotics are non-digestible fibers that feed beneficial gut bacteria. Foods like garlic, onions, bananas, and asparagus are rich in prebiotics. Omega-3 fatty acids. These have anti-inflammatory properties and can be found in fish oil supplements. Lifestyle changes. Manage stress. Chronic stress can negatively affect gut health. Practices like meditation, yoga, deep breathing exercises, and adequate sleep can help manage stress. Avoid NSAIDs. Non-steroidal anti-inflammatory drugs can damage the gut lining. Use alternative pain relief methods if possible. Regular exercise. Moderate, regular exercise can support overall gut health and reduce inflammation. Stay hydrated. Adequate water intake is essential for maintaining a healthy digestive system. Medical consultation. Testing and diagnosis. Consult with a healthcare professional to identify underlying causes and get appropriate tests. Personalized plan. A healthcare provider can help develop a personalized treatment plan based on individual health needs and conditions. While these strategies can help many people improve their gut health, It's important to work with a healthcare provider, particularly if you have chronic conditions or severe symptoms. Share your experience in the comment section. Yes. Don't forget to like, share and subscribe to my channel for more such informative videos. Take care of yourselves and stay blessed.